Second white coat. Subscribe and like. Let's learn medicine together.
So today, we're going to dive into a medical case that honestly sounds like something straight out of a spy thriller. We've got a hidden enemy, a case of mistaken identity, and a tragic civil war that's waged not on a battlefield, but inside the human body itself. We're about to find out how the very system that's designed to protect us can get turned into a weapon of self-destruction. And it all kicks off with a question that feels more like a riddle. What on earth could connect a chronic smoker's cough to a sudden, completely baffling inability to walk or even speak clearly? It seems impossible, right? But as you'll see, the answer lies in a shocking case of mistaken identity happening deep within the body. All right, so our story begins where so many medical mysteries do, in an emergency room. We have a 65-year-old man, and his body is sending out these increasingly desperate alarm signals. Something that might have started as a minor issue has just rapidly escalated into a full-blown crisis. Now, the very first major clue for the doctors is the timeline. This wasn't something that happened overnight, like a stroke. And it wasn't a slow decline over years either. No, this patient's symptoms got steadily, relentlessly worse over the course of just 2 weeks. This subacute progression, as they call it, is a huge piece of the puzzle. So what were these signals his body was sending? Well, first, dizziness. But it was way more than that. He was struggling with something called dysarthria. That's the clinical way of saying his speech was becoming slurred, really hard to understand. And he also had what's called bilateral limb ataxia. It's a fancy term, but what it means is a devastating loss of coordination in both his arms and his legs. I mean, just imagine trying to walk or pick something up and just not being able to control your own body. All of these symptoms pointed the doctors straight to one specific part of the brain, the cerebellum. That's our command center for balance and coordination. Okay, so the medical detectives now know where the problem is. But that's only half the battle. The symptoms were the what. Now they desperately needed the why. And so their investigation really began, starting with the patient's personal history. And, the patient's file gives them their next huge clue. He's 65, takes no medications, doesn't drink alcohol, so you can rule out some of the usual suspects right away. But then one detail just leaps off the page, a 50-pack year smoking history. Now, to put that in perspective, that's like smoking a pack of cigarettes every single day for 50 years. And for the doctors, that single fact, it changed everything. And that one fact leads them to order a chest x-ray. And there it is, a mass, clear as day, in his right lung. All of a sudden, these baffling neurological symptoms and that long smoking history have a potential and really sinister connection. Tragically, the patient's condition just kept getting worse, and he passed away a few months later. But the final definitive clue, the smoking gun, came from the autopsy. Under a microscope, pathologists saw it. There was extensive destruction of these very specific brain cells called Purkinje cells right in the cerebellum. This wasn't random damage. This was a targeted annihilation of one specific cell type. So now, with all the evidence in place, you've got the subacute cerebellar symptoms, the lung mass, and that specific cell death. The diagnosis finally becomes crystal clear. And it's a story of a profound betrayal by the patient's own body. The diagnosis is Paraneoplastic Cerebellar Degeneration. I know, it's a mouthful, so let's break that down. Paraneoplastic basically means related to cancer. But here's the crazy twist. The damage isn't being caused by the cancer itself spreading. It's an indirect hit. It's an autoimmune disorder where a tumor, in this case small cell lung cancer, tricks the immune system, sending it on a misguided mission to attack perfectly healthy brain cells. And this is the absolute crucial point. And a quote from the source material just says it perfectly. The tumor cells never physically invaded the brain. I mean, think about that. This wasn't a case of the cancer spreading. This was friendly fire, an autoimmune civil war sparked by the tumor hiding out in the lungs. So how does this tragic mistake even happen, right? How does the body's super sophisticated defense force get it so incredibly wrong? Well, let's take a look at the mechanism. It all comes down to a classic tragic case of mistaken identity. So first, the lung tumor starts making these proteins that, just by sheer cosmic coincidence, look almost identical to proteins found on healthy Purkinje cells in the brain. Then, step 2, the immune system does its job perfectly. It sees these tumor proteins, flags them as foreign invaders, and builds a powerful army of antibodies and T cells to go destroy them. But here's the fatal error in step 3. That very same army, now trained to recognize the tumor proteins, crosses into the brain, sees the healthy Purkinje cells and thinks, hey, that's the enemy, and it attacks them with the exact same ferocity, causing irreversible damage.
And what's absolutely incredible is that we can find the weapons left at the scene of the crime. By testing the patient's blood or their spinal fluid, doctors can actually identify the specific antibodies that were responsible for the attack, things with names like anti-Hu or anti-Yo. These are the molecular fingerprints that prove without a doubt that the immune system was the culprit.
Now, to be absolutely certain about a diagnosis this unusual, it is critical to rule out other conditions that might look similar on the surface. This is where all those specific clues we've gathered become so important. So you might be thinking, okay, but why isn't this just the lung cancer spreading or metastasizing to the brain? It's a great question, and the key difference is what you'd find at the crime scene. With a metastasis, you'd find actual tumor cells that have invaded the brain. But in our case, with paraneoplastic degeneration, the autopsy doesn't show cancer cells in the brain. It shows the absence of Purkinje cells. They've been wiped out by the immune system. And what about a cerebellar stroke? Well, the timeline tells the whole story. A stroke is sudden. It's a vascular blockage that causes damage within minutes or hours. But our patient's symptoms? They developed steadily over 2 weeks. That slow burn fits perfectly with the relentless, progressive nature of an autoimmune attack, not a sudden blood clot. And so that brings us to the final takeaway, a single, powerful sentence that just perfectly encapsulates this entire medical mystery. You take the smoker's history, plus the lung mass, plus that subacute progressive ataxia and dysarthria, plus the Purkinje cell degeneration, and it all leads to one diagnosis: paraneoplastic cerebellar degeneration, which is all caused by autoimmune cross-reactivity. It's a chilling reminder that sometimes the most dangerous enemy is the one we can't even see, the one that's already inside us. And it really makes you wonder, doesn't it? What other hidden battles are our bodies fighting right now without us even knowing?